Today on Government Matters, the Department of Veterans Affairs is the largest healthcare system in the country. It serves more than 9 million vets. The Secretary of the VA joins us to discuss new benefits, progress in addressing suicide, and the new abortion policy. Then, it's open season for the Federal Employees Health Benefits Program. We'll look at some of the big changes to look for and ways to save money. Government Matters starts right now.
From Washington, D.C. and around the world, this is Government Matters with Mimi Geerges.
This is Government Matters, the show that delivers insights on federal government programs, people, and operations. I'm Mimi Geerges. Starting January 1st, the VA will start processing claims under the Promise to Address Comprehensive Toxics Act, also known as the PACT Act. Dennis McDonough is the Secretary of the Department of Veterans Affairs. Mr. Secretary, welcome to the program.
Thanks for having me, Mimi.
So first, remind us what the PACT Act is and what it means for veterans.
So what this is a new law that says if you served in Southwest Asia, so basically that big swath of territory from Somalia in the southwest to Uzbekistan in the northeast, with Iraq and Afghanistan right in the middle, and you were exposed to toxins during that period, we now have a process whereby we'll assume that if you have a condition among the 25 or so conditions listed in that law, we will assume that you got that condition while you were serving overseas in that region. And that means that you qualify for benefits and you qualify for care. So what this means is that particularly for those Gulf War veterans, those post 9/11 veterans, having waited far too long to get care and benefits for these kinds of conditions, we now have a process to get you that care, those benefits, so we really want you to apply.
Before the act, you had to prove that you got it because of that toxic exposure and as a result of your service.
That's right. There's two questions. Do you have the condition in question? And did you get it while you were serving the country? We still have to answer the first question, do you have that condition? But this question of whether you have it, we will now assume that for purposes of benefits and care, you got it while serving the country, meaning that the burden of proof is no longer on the veteran.
You recently started screening for toxic exposure for all vets enrolled in VA Health. How is that going? Well,
it's going pretty well. So as of November 8th, last Tuesday, every veteran currently in our care, already enrolled for care at the VA, when he or she comes in to see their provider, the provider will spend, about 10 minutes with them asking about potential exposure. So about 150,000 veterans have had that screening to date. Interestingly, about 40% of them say they're worried about a particular exposure. Now, that's important for two reasons. One, that allows us to take the next step and look more deeply at what they might have been exposed to. But it also underscores an important point. These are veterans who have a relationship with us already. Imagine the millions of vets not yet in VA care. If 40% of them feel similarly, that they've been exposed, we have an opportunity with this new law to get them care and benefits that they and their families deserve.
What's the process for filing a claim, and have you been able to streamline that process?
It's a great question. So we've had, again, about 145,000 claims filed since the president signed this bill into law on August 10th. My sense is you can see that as a big number, a small number. I prefer to see it as a small number because there's as many as 4 million veterans who may qualify for care and benefits under this act. What I'd urge veterans to do is two things. One, call us at 1-800-MY-VA-411 or visit us at www.va.gov/PACT. And we'll begin that process of helping you fill out your claim. It's a pretty straightforward process. We're just doing now some market surveys of those 150,000 or so who have filed a claim. As many as 60% of them are answering the question, was it easy to file your claim? They're answering that a yes. I think that's a good sign. We'll see if those numbers hold. But please visit us at va.gov/PACT or call us, 1-800-MY-VA-411.
What about the claims that were denied in the past before this PACT Act?
Yeah, we're
passed?
asking you to come refile with us, and we'll get that process moving. Now, we have a bunch of paperwork to do. We have to establish what we call sub-regulatory guidance. We're in that process now. That process will be done by January 1. So if you file now, starting January 1, we will review that claim. But one more important thing, Mimi, for those veterans out there, please, if you file in the year after the president signed the law, so if you file before August 9th, 2023, that means your benefits will be retroactive to the day the president signed it, meaning you will accrue benefits going back to August 10th, 2022. So it really behooves our veterans. Please come file a claim. We'll get to work on it, but importantly, it will then accrue back to August 10th.
I wonder if you'll be reaching out proactively to vets that you think should be filing and haven't yet.
In fact, we are. That's why I'm here with you today. I love working with you, but I'm here particularly today to talk about this among our government employees who are veterans. At VA, almost 40% of our employees are vets. We're talking to every federal government agency about getting with their workforces. We've already done it at DHS. We'll be doing it with several others over these coming weeks. We're also, you'll be seeing pretty aggressive work with social media. I'm sure you're seeing reporting in traditional media. And as we approach December, because January is so important for us, that's when we get to start reviewing the claims, we'll be talking across the country in every state with a week of action where we're going to be working with local veterans, with local stakeholders to make sure that vets know what's available to them and urge them to come in and file a claim. Lastly, we're also talking to families. You know what happens a lot of times is it's the families who urge vets to go in and file for their claims. So we're talking to husbands, wives, sons, daughters to make sure vets know what's available to them.
Quick pause and then we'll come back.
Great.
When we come back, we'll continue our conversation with VA Secretary Dennis McDonough. Stay with us. We're back with Dennis McDonough. He's the Secretary of the Department of Veterans Affairs. Mr. Secretary, as you said, there are over 145,000 claims already filed.
Yes.
You're expecting a lot more.
Yep.
How many people are you going to have to hire to go through all those claims?
It's a great question. So we started about a year ago on the benefits side of the house, the Veterans Benefits Administration. In late September 2021, we began hiring 2,000 additional claims personnel to be looking at those claims. That's why now we've hired those people, we're training them. They're getting up the power curve to make sure that they can make good, quality, transparent decisions for our veterans. We're probably gonna need a couple thousand more on top of that. So the training challenge on the benefits side of the house is twofold. One, we need to find the employees. Two, we need to train them. That training tail can be up to a year, even longer, before they're performing at the level we expect them to perform. So that's where we are on the benefits side. On the healthcare side, you know, we may have, you know, several million new patients in the VA healthcare system, which is great news for us because vets in our care do better than vets not in our care. So we need to hire docs, we need to hire nurses. Let me give you two examples of what we need. Nurses, we need about 45,000 nurses over the next 3 years. This last fiscal year, we added about 2,500 nurses net, which tells you that we have a long way to go, but we have the tools to do it even in a competitive market. Secondly, frontline staff. So environmental services staff, for example, July was the biggest single month for hires of frontline staff and VA ever. That tells us, again, we have the tools, thanks to Congress, thanks to the President. We just have to get on it in terms of hiring nurses, docs, frontline staff. We'll do it.
Before we leave the PACT Act, I want to ask you about the timeline once you start processing claims. How long before vets get decisions, get benefits, and get care?
Well, we want to move with as much dispatch as we can. We will start reviewing these claims in January. Some of those claims will be straightforward. They'll be resolved in days. Some will take weeks. Some will take months. The most important thing is when a veteran files a claim, we'll be in touch with that veteran, making sure that they know what to expect. But please file your claim now. We'll begin reviewing them, making decisions in January. We'll stay in very close touch with that vet's family.
In early November, you had said that claims processing times in general were improving. How much have they been improving, and what's behind that improvement?
Well, so we're now resolving claims, more claims in a year than ever. Last year, we resolved 1.7 million claims. That was the highest ever year. The next highest year was the immediate prior year. Why are we moving faster? We're moving faster because we have more people, and we're beginning to squeeze out unnecessary steps in the process. For example, we don't want to send a vet back to get one more healthcare screening, one more health exam when we don't have to. We want to make a decision for that vet with the data we have. And then the second thing we're doing is we're using automated decision tools more and more. That's allowing us to resolve cases that would have taken weeks in days. So by making the process more straightforward, by making the process automated in certain places, we think we can bring those decision times down further still. That's what we hope to begin doing in January on these PACT Act claims.
I want to ask you about Roe v. Wade.
Yes.
After it was overturned, the VA announced it would start providing abortion counseling and services in some cases in the VA hospitals. What was behind that decision?
It's a health emergency. We heard from our healthcare providers. We're a high reliability organization at VA. You know what that means? That means healthcare decisions will be made by healthcare experts. They'll be made as close to care as possible. We don't need bureaucrats like me in Washington making decisions about veterans' health. After the ruling at the court, we heard from our providers that the confusion about what was applicable for veterans' health was creating a healthcare emergency for the 300,000 women vets of childbearing age who get their care from VA. So we made the decision based on the needs of our providers, but most importantly, the needs of those 300,000 women vets to provide abortion counseling and abortion services in a couple of narrow areas. One, cases of rape and incest. Two, in cases where the pregnancy threatened the life or the health of that pregnant veteran. So we're using that authority now. We're obviously responding to public comment on that, consistent with the rulemaking process, and we'll continue to unfold this very transparently.
And any thought given to expanding those services beyond those emergencies that you outlined?
At the moment, we're providing service consistent with the interim final rule we filed. We also have an obligation pursuant to the Administrative Procedures Act to respond to the tens of thousands of comments that we've gotten. We'll respond to those, make the changes we need to, and then see how this unfolds. Importantly, we believe that we've begun to address the healthcare emergency that our providers and many veterans pointed out. We'll stay on top of this.
We'll continue our conversation with VA Secretary Dennis McDonough on the other side of the break. We'll be right back. We're back with Secretary of the Veterans Affairs, Dennis McDonough. Mr. Secretary, you, during a speech earlier this month, you had said that you wanted to make VA healthcare facilities, quote, safe, respectful, and welcoming to women vets. As you know, women are the fastest growing group of veterans. How are you going to make it more respectful and welcoming to females?
Look, it's a great question, Mimi. So let me talk about some physical layout issues. some culture issues, and then the provision of care. As it relates to physical layout, what we know is that still too often in VA facilities, a veteran comes in, she gets catcalled, she gets hassled. So a best practice is establishing a specific women veteran entrance to a VA hospital, a VA clinic, and making sure that there's a specific women veteran wing to provide that care. That's the first thing we're doing. On culture, let me just give you 2 examples. We have something called the White Ribbon Pledge, which every VA employee takes. And by the way, the veteran service organizations are taking too. It just says we will not tolerate sexual harassment or sexual assault anywhere in VA. That means when we see something, we say something. Third, the provision of care. Thanks to bipartisan leaders in Congress, people like Senator John Bozeman, people like John Tester, people like Mike Bost and Mark Takano, and thanks to the president, we have new tools to provide gender-specific care for veterans. We have about 1,300 facilities across the country. Only 80 of them provide mammography on site. We should do a better job of that if that's our fastest growing group of veterans. That's the first thing. The second thing is the president now 2 years in a row has asked for historically high budgets for gender-specific care. That's the account that allows us to go buy technology like mammography. It also allows us to go recruit healthcare providers, gynecologists, obstetricians, the kind of care that women veterans are right to expect. And I'll tell you what, I've met a bunch of them on the road, including an unbelievable group down in Columbus, Georgia. I thought to myself, the more high performers like this we get, the more respectful, the more outcomes oriented for women veterans VA will be.
I want to ask you about homelessness. Their data recently shows that there's been an 11% drop in vet homelessness. What do you attribute that decrease to?
I attribute it to intentionality. As a country, and this has nothing to do with VA, this has to do with the country. The country has said, we do not allow and do not accept that there'll be homeless veterans. Somebody who is sworn to defend the country should not be homeless. Second, that's manifest by historically high budgets, thanks to the president, and then thanks to leaders like Nancy Pelosi and John Tester and others, making sure that we have the money to invest in this program. Third, how we treat this issue matters. We have a policy that says housing first. Let's get a homeless vet into a house. Then we'll get the services available to him and to her so that the reason they became homeless in the first place, substance use disorder, justice system involvement, untreated mental health issues, that we can provide them care to address those. Housing first, get them wraparound services using the resources we get from bipartisan members of Congress and the president, it works. Now,
you set a goal at the beginning of the year to house 38,000 veterans by the end of the year. How is that going?
Well, it's going well. The most recent period we have numbers for is the end of September, which would be, 3/4 of the way through the year. We were at about 32,000 veterans permanently housed this year. So that's faster than, the 3/4 of the year would suggest. We'll finish this out. We will meet or exceed that 38,000 number. Then I hope we see, again, further reduction next year in that point in time count that you referred to a minute ago. 11% decrease from 2020 to 2022. I want to see a, continued decrease 2022 into 2023.
Well, speaking of decreasing, veteran suicides also dropped for the second year in a row. What's being done differently now that's bringing those numbers down?
Well, look, first of all, it is true, as you say, that the numbers came down. The most recent year we have numbers for is 2020. So from 2019 to 2020, we saw a reduction of about 230 veteran suicides. That still means, though, that there's more than 6,000 veteran suicides that year. That's too many. In fact, one is too many. So what are we doing that's working? One, we're making sure that if a vet is in crisis and he needs access to care, that it's available. to those vets out there, I urge you to please contact us at 988. And as a veteran, just press 1. That's the veteran crisis line. Just dial 988, press 1. We'll get you connected to care today. Second, we're making sure that we're investing in communities where communities know veterans best and know the services they need. For the first time this year, we began investing in community-based organizations to make sure that programming, including non-traditional programming, that might be useful for veterans is available. Then third is, we're saying very straightforwardly, we just do not accept this. We will be intentional about it. We're talking with families, and so that veterans, when they find themselves in crisis, know that there's services available. So I urge family members, take a look at va.gov/reach. That allows you to know what services are available now, so that if your veteran's in crisis, you know who to call. We're here for you. We want to make sure that you know that, and we simply will not rest until we get this to zero.
Secretary McDonough, always good to talk to you. Thanks so much.
Thanks for having me, Mimi.